Taking Small Steps to Stay Up and About, a falls prevention film. Being up and about is really important. We can keep doing things we enjoy, and it helps us stay connected with the people and places most important to us. Falls, or fear of falling, can stop us from being up and about. Did you know that around 1/3 of older people in Scotland fall down at least once a year? It's a big cause of hospital admissions and can result in serious injuries and long-term complications. Because of falling, many people lose their confidence, even if they haven't hurt themselves. However, falls are not an inevitable part of getting older. There are 7 simple steps you can take to reduce your chance of falling, prevent serious injuries if you do fall, and keep up and about. Step 1. Top-to-toe check. If you can't see what's around you and where you're going, you're more likely to fall. Have your eyes tested every year if you're over 70. This is free on the NHS. The optician will also check for things like glaucoma, cataracts and other eye health conditions. If you wear glasses, it doesn't mean that they're still the best for you now. If your vision changes, don't wait. Go and see your optician as soon as possible. It's important to take care of your feet, whatever your age. Problems like calluses, long toenails, poor circulation or loss of feeling can make you unsteady on your feet, as well as causing pain and discomfort. Footwear makes a difference. Wear shoes and slippers that are comfortable and fit properly. Low and broad heels help with balance, and styles with fastenings give you more support. Don't ignore pain. If you're worried about your feet, contact your local NHS podiatry department or your GP for advice. Learn about your medicines and ask questions. If you take prescription medications, your GP or local pharmacist should review this regularly. You may no longer need to take all of them, or the dose might need to be changed. Check if it's okay to drink alcohol if you're on the medication. If any of your medications make you feel faint, drowsy, dizzy, unsteady on your feet, or give you blurred vision, check them out with your GP or local pharmacist. Remember that over-the-counter medications can have an effect on other medications you're taking. Tell the pharmacist what other medication you're on. Step 2. Eating well. Eating a healthy, balanced diet helps you to keep well. It's important to eat regular meals and make sure you drink plenty of water throughout the day. As we get older, our bones become thinner. It's important to keep your bones strong, so there's less chance of breaking a bone if you do fall. One of the ways you can do this is to eat a well-balanced diet with plenty of calcium. Top calcium foods include milk, yogurt, and cheese. To help you eat less fat, you can choose lower fat versions. Step 3. Vitamin D check. Vitamin D is important to keep bones strong and muscles healthy. You should get most of the vitamin D you need from natural sunlight. Not so easy in Scotland. Try to spend at least 10 minutes outside once or twice each day during the summer months, but be careful not to burn. If it's difficult for you to get outside, you may want to consider taking a supplement. Step 4. Staying active. If we keep active as we get older, we're more likely to lead an independent life. Whatever your age, it's important to be as active as you can be. Sit less, move more. Being active has many benefits, even for people who've been inactive for years. Regular activity helps to strengthen muscles and may improve balance, stamina and flexibility at any age, as well as reducing joint pain. This all helps to reduce the risk of a fall. There are many ordinary daily activities you can do to keep active, such as walking, gardening, or even doing the housework energetically. Exercise that helps our muscle strength and balance is best for preventing falls. Ask your local leisure centre about strength and balance exercise options, including Tai Chi. Step 5. Moving about safely at home. As well as looking after yourself, you need to be aware of other hazards that could cause a trip or fall. Over half of all falls happen at home, where we spend much of our time and tend to move around without thinking of our safety. So it's often helpful to have someone else, like a friend, relative or neighbour, to help you check for hazards. There are many trip hazards that are easy to do something about, such as poor lighting, especially on the stairs, loose rugs, trailing cables, and leaving clutter on the floor or stairs. Getting up at night can be a risky time. If you do need to get up, make sure you put a light on. Put on your slippers and glasses. Use your walking aid if you have one. And if you have a personal alarm, take it with you. If you think you need it, your local council will be able to provide advice about special equipment that might help with day-to-day activities around the home. Step 6. What to do if you fall. No one wants to have a fall, but it's worth thinking about what you would do if you did fall. There are simple steps to remember for any fall. The first thing is to stay calm. Lie for a moment and assess the situation. Check for pain and injuries. If you can't get up without help or you're hurt, call for help. Use your alarm if you have one, or shout and bang on the wall to get a neighbour's attention. If you can, use a mobile or crawl to a telephone to call for help. If you're injured, dial 999. Move to a soft surface. If you land on a hard surface, like a bathroom floor, try to move on to a carpet. Keep warm. Try to reach for anything nearby which will keep you warm. This could be a duvet or clothing. If you're in a draft, try to move out of the way of it. Keep moving. Try to rock gently from side to side, but keep any injured part of you still. If you lie still for too long, you'll become stiff and cold. If you have a fall and you feel you can get up, first of all, check that no part of you is injured. Everyone is different, so there's no set way to get up after a fall, but remember to be careful and take your time. You can use a solid piece of furniture or the bottom stair to support you as you get up. If you know you can't get up from the floor yourself, your local council can tell you about community or pendant alarm services in your area. Step 7. Telling someone. Falls are not an inevitable part of getting older. We shouldn't accept them as normal. There are many things you can do to reduce your risk. Talk about it. Ask your GP or healthcare professional, such as a physiotherapist or occupational therapist, for advice. And talk to your friends and family too. Think about the 7 simple steps you can take to reduce your chance of falling. Prevent serious injuries if you do fall. Enjoy life and keep up and about.